Hello, dear friends. I am Dr. Azarbani. Let's learn more about HIV. If you have been diagnosed with human immunodeficiency virus or HIV, you're bound to wonder how it will affect your future and how long the future might be. HIV positive people are living increasingly long lives. Many people living with HIV can expect to live as long as their peers who do not have HIV. Studies show that a person living with HIV has a similar life expectancy to an HIV negative person. If they are diagnosed in good time, have good access to medical care, and are able to adhere to their HIV treatment. A number of factors can affect the life expectancy of people living with HIV. There are differences in outcomes between different people depending on these and other factors. Access to effective HIV treatment and high-quality medical care. Having a high CD4 count and undetectable viral load. People with a high CD4 count and undetectable viral load have much higher life expectancies than those with low CD4 counts and high viral loads. Your current CD4 count and viral load have a much greater influence on your life expectancy than if you had a low CD4 count and high viral load in the past. So, finding the right treatment for you and staying on it can improve your life expectancy over time. Having serious HIV-related illnesses. This may have occurred before HIV was diagnosed and or before HIV treatment was begun. Other health conditions such as heart disease, liver disease, and cancer, they are more likely to be the cause of death than HIV. Injecting drug use. Life expectancy is shorter for people with HIV who inject drugs due to drug overdoses and bacterial infections. It is also important to consider things that affect anyone's life expectancy, whether or not they have HIV. Social and economic circumstances. There are important differences in life expectancy according to where you grow up, your income, education, social class, and so on. Gender. Women usually live longer than men. Genetics. You may be more likely to develop certain conditions if you have a family history of them. Mental and emotional well-being. Higher levels of stress are associated with reduced life expectancy. Lifestyle. Life expectancy is longer for people who have a balanced diet, are physically active, maintain a healthy weight, avoid excess alcohol or drug use, and remain socially connected. Avoiding smoking is particularly important for life expectancy. To support my channel, please subscribe, like the video, and write your opinions. Thank you. Now let's learn how is life expectancy calculated. Life expectancy is the average number of years that a person can expect to live. More precisely, it is the average number of years an individual of a given age is expected to live if current mortality rates continue to apply. It is an estimate that is calculated by looking at the current situation of a group of people and projecting that into the future. However, HIV is a relatively new disease and HIV treatment is a rapidly changing area of medicine. It is therefore hard to know whether our current experience will be an accurate guide to the future. At the moment, there are a large number of people living with HIV in their 20s, 30s, 40s, 50s, and 60s. Current death rates are very low, resulting in encouraging figures for future life expectancy. But we have very little experience of people living with HIV in their 70s or 80s. So we know less about the impact HIV may have later in life. Also, healthcare for people with HIV is likely to get better in the future. People living with HIV will benefit from improved anti-HIV medications that have fewer side effects, are easier to take, and are more effective in suppressing HIV. Doctors' understanding of how best to prevent and treat heart disease, diabetes, cancer, and other conditions in people with HIV is improving. And this could mean that people actually live longer than our current estimates suggest. Thanks for watching. Please let me know if you have any other question.